The thought of a vasectomy is not a comforting idea for any man. Attempts have been made to reduce the fear factor associated with vasectomy by using marketing terms like no scalpel vasectomy and no needle vasectomy, but the fact remains, vasectomy requires the severing of the major link between a man and his testicles, and no man likes that idea. Now, however, there is an alternative to that fearsome thought. Pro-Vas occlusion blocks the flow of sperm through the sperm duct, or vas, using a small, implantable spring clip. By merely crimping off the vas, rather than cutting it in half and removing a piece, the man is able to maintain the important psychological link that he has with his manhood. The Pro-Vas device has been shown to provide effective permanent birth control. The Pro-Vas procedure is a revolutionary concept that radically decreases the surgical impact on a man's sexual anatomy, reducing postoperative pain, minimizing the risk of complications, and shortening his recovery period.
I would recommend the Pro-Vas procedure to anyone. It was quick, it was painless, and after the couple of days of recovery, my wife and I were able to pick up where we left off.
Pro-Vas also offers advantages for men who may later decide to have their procedures reversed. The vasectomy reversal procedure, called a vasovasostomy, is likely to be much faster and technically easier to perform on Pro-Vas patients. Since with Pro-Vas, the treatment site is easily located and a maximum amount of the vas has been preserved to allow for an easy reconnection of the two ends once the clip is cut out.
With the vasectomy, the Pro-Vas clip, all you have to do is find the clip. You'll be able to put the two ends together easily. You'll still have to cut the clip out, but they'll be right there, easily to find. It should save easily an hour on the procedure.
The clinical outcomes with traditional vasectomy techniques can vary widely depending on the technique used and the skill or experience of the surgeon. Pro-Vas provides consistently good results, largely independent of surgical experience, so that men can be confident in the results of their procedure.
Pro-Vas is such a simple procedure that it could standardize this technique. It certainly is going to make it a much more available procedure to the occasional vasectomy surgeon who wants to do a vasectomy but doesn't have a lot of experience, and that's because of its ease of application.
The FDA-cleared Pro-Vas occlusion device represents the newest technology for permanent male sterilization. It provides men with a dependable means of permanent birth control without the level of pain and complications or psychological stress that can come with traditional vasectomy. Men who may later wish to reverse their Pro-Vas procedures may also benefit from a faster and technically easier reversal procedure. Pro-Vas is a major advancement in male contraception that will not only improve clinical outcomes, but will allow more men to feel comfortable accepting the responsibility for birth control. If because of Pro-Vas, more men choose permanent sterilization, unwanted pregnancies will be reduced.